Hello, everybody, and welcome to our new interview series, a COVID-19 interview series called Rising to Meet the Moment, where we engage with stakeholders to discuss how different aspects of the behavioral health system are responding to COVID-19 and are, in fact, rising to meet the moment. I'm Kevin Riggs on behalf of the Behavioral Health Action Coalition, whose mission is to engage California leaders to prioritize behavioral health and to reduce stigma. And joining us today via Zoom is one of BHA's co-founders, Jessica Cruz, the president and CEO of the National Alliance on Mental Illness California. Hi, Jessica.
Hello.
Well, how are you doing during this sort of lockdown period?
Yeah, I mean, personally, it's been a challenge trying to balance, being a working mom, and then now having the kids home and being a teacher and a working mom. But then within NAMI, we are staying strong, and things haven't really slowed down for us much, as you could imagine.
Yeah, in fact, I was going to ask you about what the impact COVID-19 is having on the organization itself, its members, its network affiliates. I mean, a lot has changed, obviously, in just the last few weeks. And I think people are in many respects, kind of struggling to adapt and to get used to this new situation. But how's NAMI affected?
Yeah, so there's several different buckets. The way that I see it, right? There are the people who have serious mental illness right now, who we've been advocating for over 40 years, for them and their families, who are impacted by this. Whether it is the change in just basic needs of working with a social worker, being in a board and care home, they can't even connect with their family members right now. Little things like receiving their SSI check and not being able to necessarily go to the grocery store with their social worker. They used to receive it by hand at one point, and then now it's trying to find an address that works for them. And so we at NAMI are trying to make sure that family members are still being and feeling connected. There's also that mental health and wellness component that I think is affecting a lot of us, where it is maybe some of our own triggers are starting to get notched with anxiety and depression. And we were talking earlier about how, that can manifest in different ways, whether it's eating poorly, not exercising. And so you see a lot, and on our website at namica.org, we have a special page for COVID-19 that has resources and tips and tools. But you're seeing a lot of talk in the behavioral health space about making sure that we're taking care of ourselves when it comes to wellness. And then the third bucket that I see is kind of this second wave of the tsunami pandemic, as I see it, right? Because tsunamis have three waves. The second and third wave usually is probably the hardest hit when you talk about tsunamis. And for us, the way that we're seeing it with the trauma of our frontline workers, our doctors, our nurses, our hospital staff, the essential workers, we're anticipating that there's going to be kind of a hard hit of trauma that is not only for our frontline staff, but those people who have been really severely impacted by this virus over the last few months. And so at NAMI, we're trying to make sure that we're continuing to advocate for those people who are currently living with a serious mental illness, making sure that we're helping people in intervening early and some sort of prevention pieces so that we can get a handle on our anxiety and our depressions while we're at the stay-at-home. And then also preparing through adapting some of our NAMI support group programs, education programs, to make sure that we're able to help those essential workers, the frontline staff, and also youth and children and students at home. We're trying to work with the Department of Education to implement some sort of a curriculum to help students and teachers and parents while they're at home kind of manage this as well.
So are you concerned that we're going to see kind of a wave of demand for mental health services once we get to the period where, I'm not going to say things are returning to normal, but closer to normal?
Yeah, I think that we already are in a lot of cases. So a lot of our warm lines, we've heard and read stories and articles about suicide prevention lines getting an uptick in calls. And I think a lot of it is just trying to figure out where they go and navigate the system. I mean, NAMI California, we are not a warm line. We are in some talks about creating a triage line in some ways, because the calls that we get, which are hundreds of calls, and on our answering machine at 2 o'clock in the morning, somebody just saying like, I can't get a hold of my loved one. I don't know where they're at, or their board and care, home is closing down, or I can't figure out how to get their certain information to their doctors. And a lot of it also is just the connection with telehealth and making sure that our behavioral health system kind of stays manageable, but also there is a significant investment of funds in making sure that we are prepared for this second wave of individuals that may need those extra resources and education.
So clearly, NAMI California is on the front lines, along with other healthcare professionals and experts, on dealing with COVID-19 and the impacts. Are there some inspirational stories that you've heard from members and others that you might want to be able to talk about?
Yeah, absolutely. Our affiliates, we have about 62 throughout the state of California, are just doing an amazing job. I'm so proud of them and their family members and individuals who are still volunteering on the warm lines. We have really jumped from the in-person support groups and classes to virtual classes and support groups. And so it's been really exciting to watch all of our affiliates and family members kind of rise to that occasion to make sure that we're providing services and supports to people who need it the most. And so really the success stories are the willingness of peers and family members to kind of step into that gap of service right now, of saying like, we're here to help in the best way that we know how. And to be honest, a lot of our state partners are doing an incredible job. Our county behavioral health directors, they're trying to figure out the best way to provide services locally to the people who are in the public mental health system. Our Department of Healthcare Services, they're all really stepping up to meet this moment and show that they are ready and willing to make sure that people are receiving the services. We are hitting a lot of road or gaps in the road where it's whether it's telemedicine. A lot of our people with serious mental illness don't have access to technology and Zoom, let alone a phone, and they would rely on public libraries to be able to offer that to them. And so we're starting to see, again, our affiliates step in, NAMI California, trying to find innovative ways to be able to provide our services and support. So really the heroes are those individuals who are stepping up and rising to the occasion to help people through this challenging time.
Well, so much of this pandemic, as you know, is unprecedented. There's an awful lot we still don't know. And for example, the hospitals have had to gear up very quickly to deal with folks who need help, whether they've been infected with the virus or if they have other ailments, and all kinds of concerns about supplies and adequacy of supplies. Could your organization have been fully prepared for something like this, given all the unknowns that are out there, or are you just kind of learning as you go? How would you say?
Yeah, I think that we've had to really adapt as we go, right? We've had to make some major changes very quickly. And I think all of us have been doing that. I do think that it's a great opportunity. As much heightened awareness there is around behavioral health, there's also this opportunity to see the gaps that are needed so that we can fill them, right? A lot of our advocacy is around making sure that the funding streams are kept in place, and that if we're talking about new ways of delivering behavioral health services, we also need to be talking about new funding streams to invest in those services and not trying to, stretch the very limited dollar that we have. And so the great part about this is that we're able to kind of see some of the opportunities that we have and change the way that we deliver these services. And so like the telemedicine piece is something that we have been advocating for alongside with our hospitals and clinicians, to make sure that those people who are hard to reach are able to get like some assessments even and check in with their doctors. And so that is nice to see that there's kind of getting some traction around that. But again, there is that digital divide in those people who don't have access to technology that we still need to figure out ways to deliver these services. But I don't think anybody could have been prepared for what we are doing. But again, the most hopeful piece about this is we're really seeing some heroes here within California. Our leadership within California has really stepped up, doing a great job in communicating, in making sure that all the individuals of California are taken care of. And so we're really hopeful about the way that we're going to be working together in the future. But I do think that our advocacy is, treating people with severe mental illness and making sure that those people who are on kind of that brink of being diagnosed with a severe mental illness are taken care of just as well as our kids within the school systems and the foster care systems, and making sure that our population of individuals with serious mental illness are not left behind in all of this as well.
Well, you talked about the importance of telehealth as one example, but as you look at how folks have been affected by the coronavirus and the shutdowns and so forth, and as we wait word from the governor on when we're going to see some relaxation of the restrictions, if you had a magic wand, you could wave it to do something to help folks, what would you say it could be? What's something you could look at?
I definitely think that, if there was a magic wand to help people, there would be one phone number that people could call when they're trying to figure out where to go when it comes to behavioral health within the current crisis that we're in and beyond. One place where we can get direction, whether it is, just being handed off to a warm line call center, a suicide prevention, or helping somebody who can, fill out their paperwork for Medi-Cal if they're being released from jail or prison. So there should just be one place. If you look at the incredible resource that the governor's office has put together on the covid19.ca.gov website, there is a list of wonderful resources. The problem with that is that as an individual user, you have to try and figure out what it is that you need to get. And so I think if there was a magic wand, there would be one number that could triage you to the best place possible. I also think that if there was a magic wand, I would love for all people who have severe mental illness, people who obviously are homeless, it's hard to find that digital connection. So if we could figure out a way to get people connected to not only treatment with their providers, but support groups with their peers, especially when we're in this physical distancing time right now, it's so important. I know Zoom and these calls have really brought smiles to my face every day. It's so lovely to see you guys. And it creates that sense of connection that I think we're all so desperate for right now. And so making sure that we're closing that digital divide and allowing people to have access to people at this point.
Well, and speaking of resources, NAMI California, obviously an important resource for millions of Californians and their families around the state. And you talked briefly about it, but if people need to find out more and they want to take advantage of the resources that NAMI California offers, where should they go?
Yeah, our website has a lot of resources, especially around COVID-19 right now. And that's www.namica.org/COVID-19. And then also, if you just want to go and find your local affiliate, like I said, our local affiliates are doing a great job within their communities, really talking to individuals on the phone through their warm lines. You can find your local affiliate on our website, namica.org as well. And you can always call our office. We actually transferred all of our phones to our homes. So between the business hours of 8:30 and 5:30, you could call our office at 916-567-0163, and somebody will be there to answer your call and at least be able to help navigate you to the right person that you need to get a hold of.
All right, Jessica Cruz of NAMI California, thanks for all that you do.
Thank you. It was so good to see you.
Same here. And to those of you in our audience, thanks for joining us. Rising to Meet the Moment is a production of the Behavioral Health Action Coalition, which represents more than 50 organizations advocating to raise awareness about behavioral health issues in California. Thanks for joining us.